Hi, my name is Robin Moulder, and I am a transplant patient. I was originally diagnosed with Hodgkin's lymphoma in November of 2003. I was 4 months pregnant at the time when I was diagnosed, and the first two doctors that we spoke to had recommended that we terminate the pregnancy, but we, through a lot of prayer and persistence, found our way here to Sloan and met with Dr. Portlock. We went through the pregnancy, very monitored, and I had chemotherapy, and everybody assured us it was, chances were very high that everything would be fine, and, we would just be done with this after a few months. So completed the pregnancy. I had a little girl, had my treatment, and then my worst fears came true. After my first CAT scan, the cancer was back. And at that time I was recommended to have an autologous stem cell transplant, which we chose to do. And pretty much followed the protocol that Kathy talked about. I was admitted after having 2 cycles of chemotherapy. I began my radiation as an outpatient. I had radiation twice a day for 5 days, and I was admitted. I had another cycle of chemo, and I completed the radiation here. And that was 3 years ago. It was 2005 that I went in. June 16th will actually be my 3-year anniversary of my transplant. And the thing that I remember the most about the actual physical experience of it was very much like Jonathan said. You kind of feel like you have the flu. I had very bad side effects with respect to the stomatitis or the mouth sores. I remember one of my nurse practitioners looked in my mouth with a little flashlight one morning and said, "Wow, this is a really big case of it." And kind of thought to myself, that's not what you want to hear your nurse say. So I guess it's really, pretty severe in there. But I was taken aback because I thought to myself, it doesn't hurt that much. Those pain medications are really good. They're a godsend. So, I know, being on that was a very, kind of like a stark reality to me. I just realized how lucky I was to have people who were watching me, and how fortunate I was to have the technology here that really gets you through what could be an otherwise very painful time. Very different than it was 20 years ago when Jonathan went through it. The actual day of the transplant itself was, I agree, wholeheartedly, totally anticlimactic. Probably just the easiest part of the whole thing. You're just laying there in bed, you get the cells back, and you just kind of move on. I remember having a little bit, feeling like chilled and kind of cold, and people kind of putting blankets on me, but pretty much slept through the rest of the day. The real difficult part of the whole thing is the recovery afterwards, and then also being in the hospital. I was in the hospital for about 5 weeks. And I had, obviously, a child that I just spoke about, a 1-year-old at home, and I also had my older son is 5. For me, going into it and going through it, the separation from my husband and my children was probably the most difficult part. I anticipated how bad it was going to be beforehand, and I was real worried about it. And even before I even got into the hospital, I spoke to the social workers here and the nurses who gave me just fabulous advice and fabulous ways to help me deal with being away from my kids, because they weren't able to visit me, and I really wasn't able to see them other than on the computer. We had the computer set up, and we were able to talk at night via the computer. And I used to, do a whole bunch of things. I sent emails home to them. I used to email my son a bedtime story every night, which actually, as I read them now, they're pretty funky. They're pretty fun. But we used a lot of the support systems that are here to get through that. And as I recovered, slowly but surely over those next few weeks, I realized my strength was coming back. I started to feel a lot less fuzzy as we decreased the pain medication. I never really experienced any severe GI symptoms like vomiting or nausea or anything. I definitely had some diarrhea with it. But those were the main kinds of things. For me, needing the support and accepting the help that was here and offered to me was very important. I used a lot of the services through the complementary, the alternative medicine.
Integrative medicine
department, which was fabulous. Being alone in a room can kind of wear on you. And there are those 10 days or so where you really don't leave the room, so it can be a very isolating feeling. My family was on Long Island. I didn't have a tremendous amount of visitors, so having somebody come in and talk to me and maybe do some yoga or do some massage or do some meditation was a godsend. And I'd highly recommend, that worked, was a very important part of my recovery. I was released from the hospital. It took me a little bit longer to be able to drink 2 liters of fluid a day and to stay with that consistently. So I got out just like in the first week of July. I think it was actually July 5th. It was the day after the 4th of July parade, I remember, seeing all the pictures from that. And when I got home, I felt pretty well, tired, but not, I wouldn't say I wasn't able to do things. I remember climbing the stairs for the first time was hard. But I also remember the day after getting home, I went out and took a walk around the block, with my husband, and I felt okay. I didn't feel like running a marathon, but I also didn't feel like all I could do was lay on the couch all day. I definitely was surprised at the amount of energy I had as compared to what I thought I was going to have. The doctors saw me, I think, probably every week, in the very beginning, and watched me really closely, and day by day I got stronger, and I felt like every day I felt a little bit better. But then at the end of the first month at home, I realized how much better I actually felt than I did when I got out of the hospital. I think I was ready to go back to work by my own assessment by about September. So I was home about 2 months, and I kind of felt like I was well enough to go back to work then, but we held off for another 3 or 4 weeks, and I went back to work in October. So I had gained a lot of my weight back. I lost about 25 pounds while I was in the hospital. I had lost all my hair, and by the time November came around, I had pretty much gained a good portion of that weight back, and I had hair all on my head. I remember that because I had to go to my nephew's wedding, and it was really important to go without a wig. And I was able to do that. So I would just encourage everybody to allow people to help you. That was an important part for me. People want to do things. And somebody said to me, because I was very much like wanting to do for myself and kind of needing to feel like I was okay. And I remember one of my friends saying, "You're robbing me of my opportunity to get brownie points for heaven. So, let me help you." And I realized that it was much better for all concerned if I did accept help with the kids, with household chores and such. And I think allowing myself to take that time really improved my overall health, both psychologically as well as physically. And it was a great day getting home. But then I realized, like, when I went back to work, then I finally really felt like I had gotten my life back, and felt like my family had kind of normalized again after going through that, because like Jonathan said, everybody's going through this with you. It's not just you. Your kids are affected, your family's affected, even your neighborhood. Like we have a close neighborhood, and everybody was real concerned, and it was a good feeling, but it was an even better feeling to go back to work and feel like we were kind of past it. And then you just, you follow up from there on, and, a few years later you realize, boy, that was a lot to go through, but, here you are, and, you've achieved it, you've accomplished it, and, you've got the rest of your life ahead of you. So it's a good trade-off. Right now you're in a position where you're anticipating this, 3 weeks, 4 weeks, 5 weeks, 10 days, whatever it's going to be. But, when you look back on it, it's really worth it. Getting through the boredom, getting through the side effects, getting through anything that your own personal experience is going to be. There's so much here. There's so many people and so many resources here that I think Eric will talk more about to help you to deal with it. And I would recommend that you certainly accept that help. Does anybody have any questions? Yeah.
When you went home, were your children allowed to be there?
Yes, they were. They were, and I was probably more nervous about the infection control. So we had Purell bottles all around the house, and we just made sure everybody washed their hands really well. And if the kids did get, because they were both really little, if they did get colds or something, I tried to keep my distance, but it was fine. I mean, nothing horrible ever happened. I even have a dog at home, and he was, other than, I didn't take care of him when we went out on a walk or anything, but, we had him in the house and he was fine, and, the doctor said that was okay.
That's it for today. I want to thank you all for coming. I want to thank you for watching, and I encourage you to contact us if you need anything before you come in for transplant. Otherwise, we'll see you soon, and good luck. Thank you very much for coming.